Hi, welcome to my channel. If you've subscribed, you know I'm Valerie Hartman. I'm a hospice nurse. I've been working for about 21 years in the field. I am a CTRN, Complementary Therapy, Hospice, and Palliative Care nurse, a unique role that's been innovated for the past 10 years at Holy Redeemer Hospice in Philadelphia, Pennsylvania. I started this channel so that I could bring together a collection of end-of-life education off of YouTube that I will subscribe to, that I feel is very useful and important information for anyone who is looking into end-of-life issues and trying to learn more about what it is to die in our country. My strongest interest is in the integration of complementary therapy, which is massage, bodywork, aromatherapy, pet therapy, horticulture therapy, mind-body techniques, meditation, guided imagery, progressive relaxation, etc. These modalities, in my view, are non-pharmacological adjuncts to the medications that we use to help ease sufferings, promote and enhance comfort, find ways of connecting through the senses when words are lost, meeting emotional needs, intimacy needs at the end of life. They're vital therapies that we should be looking much more deeply at and utilizing in a professional way in hospice care as well as palliative care, oncology, geriatrics, and all healthcare settings in the future. However, in hospice care, the way our Medicare system reimbursed hospice, it really is one area where we can find ways to integrate professionally and therapeutically, and it's such a useful arena for others to come and learn from us as we begin integration into our healthcare system. So, having said that, I want to talk in this video briefly about the fight or flight response. I touched on it in the last video. After defining what complementary therapy is, I mentioned that all these therapies do target the fight or flight response. They do many, many other things, and each in their own way do many things for individuals, but they do all work to bring someone into a state of relaxation, whether it's directly or indirectly. Massage and reflexology and touching the nervous system and the skin and circulation will directly bring someone into a relaxation state if they're comfortable with that kind of touch. And an example of indirectly bringing someone into a relaxation state would be if somebody has worries, fears, can't voice them, children, who might benefit from the use of art therapy as a form of communication that might be a form of expression that might help then ease someone's fears and anxieties, or there can be a communication component that actually gets something communicated that eases worries and fears that are permanently resolved. So I like to teach about the fight or flight response. I think if we're going to look at one way that Western and Eastern can understand each other, or holistic minded versus scientific minded can understand each other, or mind and body connect, we have to go and look deeply at this response in the body, because this is where it's all significantly happening. At least that's what I observe and what others observe. It's so easy to observe in end-of-life care. So our fight or flight response is a nervous system response. It's an innate nervous system mechanism that serves us for fight or flight, for survival. So we're born with it. We have a brain, we have a spinal column, we have thousands of peripheral nerves. We have 1,000 peripheral nerves that end on each hand. We have 7,200 peripheral nerves that end on each foot. And we have a little specialized ganglion chain of nerves called the autonomic nervous system. I teach that I can remember autonomic because it sounds like automatic. And that's exactly what it does. It really responds automatically to what our body picks up and senses in the environment or internally that might be a threat to us, so that our bodies can prepare for reacting to a situation in threat. So if I'm hiking, I hear rustling of leaves. I'm up in Montana. There really are grizzly bears, that are a threat to me. Before I'm even aware of that thought, I might hear or sense something in the environment that alerts my body to be a little bit more guarded. So fight or flight will send messages, and adrenal glands sitting on my kidneys are going to release hormones, stress hormones, cortisol, adrenaline, that are going to change the way my body functions. It's going to take the resources I have in my body, and adrenaline and cortisol are going to change how my body functions. How's that going to change? My heart rate is going to increase, my respiratory rate is going to increase, glucose is going to be released into my bloodstream. I'm going to get a quick burst of mental clarity. I'm going to get farsighted vision. And one of the big things that happen to prepare you for fight or flight is that your muscle tension gets high. There's an opening up of blood vessels, vasodilation in your skeletal muscles, so more blood is brought into your skeletal muscles to prepare you to fight harder or run, farther and faster. And that blood in your body has to be borrowed from somewhere. We just don't make extra blood as a resource to enter into our skeletal muscles. So what happens is we vasoconstrict a little bit in our GI tract and around our kidneys. We don't have to eliminate in a time of threat. It's meant to be a temporary response. We don't have to digest in a time of threat. It's meant to be temporary. So we borrow these resources and our body kind of redistributes things. And so when we are in this sympathetic autonomic nervous system state of arousal, fight or flight, we feel a little more breathless. We hear and feel our heart pound. We feel anxiety, the literal stimulation of the nervous system that does not feel comfortable. It motivates us to move. And so anxiety can range from a low level mild anxiety to a very high panic level. We talk about deer in headlights, where you're so in a state of fear and fight or flight that we really feel it's when you feel stuck that you're a deer in headlights, where you can't move, you're frozen to respond, you can't fight, you can't run, you feel probably impending doom next, like okay, now the threats arrived and I can't do anything about it. So we have different states and levels of anxiety and arousal. Very, very uncomfortable and certainly motivating to do something. So how does this play out in hospice care, in illness, in the healthcare system? Well, fear and anxiety and worry and grief states as well can trigger us into a state of fight or flight. And so we see very high levels of anxiety sometimes in end-of-life care at one time or another, and sometimes it's prolonged, it's sustained. Caregivers, family members also have anxieties and worries about changes that are happening. And so, you also have someone's body who, is declining and can absorb these stress hormones very well. And so when you are taking care of somebody who has an advanced illness with disease progression, you see the physical symptoms of the disease. Someone with lung cancer, maybe breathing more rapidly because they have a tumor or some tumors in their lungs that, require the body to breathe more rapidly in order to get oxygenated. But if somebody's anxious and fearful the day that they wake up for any given reason, the fight or flight response is going to be kicking in, and so the respiratory rate will be even higher. And so if I apply a bodywork therapy or music or presence or a meditation or a prayer with somebody, and it lowers someone's fear and anxiety, the stress component of that shortness of breath will go away. We'll never change the respiratory rate from the disease in the lungs. But the stress component of the shortness of breath will be affected by non-pharmacological complementary alternative modalities that are applied in care. So the symptoms that I coined stress-related symptoms, that we see really positive results when applying certain holistic therapies, lie in the systems of the body that are stress sensitive. So that would be shortness of breath. It might be some cardiac symptoms, anxiety itself, nausea, elimination, digestion, and like I said in the first video, it spins into sleeplessness, appetite, a sense of wellness or not a sense of wellness. And I always teach that literally, to provide somebody with an opportunity for peace, the literal feeling of peace is the parasympathetic relaxation state of the nervous system. So if we're going to provide people on hospice care with an opportunity for peaceful life closure, well, first of all, we need the whole interdisciplinary team working professionally with the patient and family to help them to have an opportunity to transition into a peaceful mind and a peaceful body. That's why we have interdisciplinary care. But I think that we're really missing the boat if we aren't looking at complementary therapies as a target therapy that can be used by, any of the team members, or we can have access to them through hired hospice complementary therapists who are professionals at what they do. They can come in and help provide peace to the mind or peace to the body, even if temporarily, while permanent changes are being made towards peace. So I think that is the most of what I want to say in this webcam about complementary therapies and end-of-life care. And I'll make another one on another subject soon. Thank you for listening.